I'm an interventional cardiologist, and I place balloons and stents to open up blocked arteries to include patients who are having a heart attack. I put in pacemakers, and I'm a general cardiologist too. So Riverside has always been, and one of the reasons why I am here, a community-centered hospital system. Quite passionate about that, and in that setting, it is the reason why I support Riverside. I do believe that cardiovascular disease is the most common killer still in the country, and this is where we take care of those problems. So Riverside has our cardiovascular service as one of the standard bearers of cardiovascular care, certainly in our community. We provide a care to include management of acute heart attack and acute stroke. Here in the electrophysiology lab, we take care of patients with even common arrhythmias such as atrial fibrillation, and ablations can be performed, to life-threatening arrhythmias such as ventricular tachycardia, and common arrhythmias such as other rapid heart rhythms, supraventricular tachycardia, where patients can suffer bad outcomes to include passing out. We implant defibrillators here. These are life-saving devices, and really designed for a laboratory like this. Our interventional radiology suite allows us to perform complex arterial and aortic disease management strategies where we can perform them with catheters and without surgery. So approximately 2 years ago, our team built a hybrid operating room where we perform many of these same procedures in the setting of the operating room. And that is one of the services that we can provide, the only one on the peninsula. Actually the only one in the region except for Norfolk. Where hybrid laboratories have become state of the art. It's become really quite interesting that we've evolved with medicine, which is changing daily.
As a non-invasive cardiologist, I specialize in general cardiology, preventative cardiology, and imaging, of course. Imaging includes transthoracic echocardiogram, transesophageal echocardiogram, and stress testing, including treadmill stress testing, stress echocardiogram, and nuclear medicine stress testing. Non-invasive cardiology is continually growing, and as such there are great new innovations coming forward. One of the things we have started to use more recently is 3D echocardiography, which helps us to visualize structures in a 3D view as opposed to the standard 2D view that we've normally seen with echo. This helps in preparing for valve cases, both with interventional and our cardiac surgeons. At Riverside Cardiology Specialists, we are able to offer technologies that are cutting edge so that patients do not have to travel to other institutions or far away from home to get their testing done. Cardiology is always advancing, and quite rapidly, so there are always new technologies, new procedures, and new medications for our patients. I'm particularly proud at Riverside Cardiology that we incorporate the newest trial data into our practice. And particularly for myself, I am very interested in women's cardiovascular disease, and we have recently started a women's heart center here at Riverside that I am the director of. So that is something I'm very proud of, and something that is cutting edge in cardiology today. The Women's Heart Center focuses, again, on women's cardiovascular disease, which is so important as cardiovascular disease is the #1 killer of women in America. That is a fact that is not well known, and most women are actually not aware of that fact. They're also not aware of the traditional and non-traditional risk factors that portend increased risk to cardiovascular disease. And at the Women's Heart Center, we have a comprehensive approach where we discuss risk factors, again, education, and then we discuss what testing would be necessary, if any at all. And as the only female cardiologist on the peninsula and at Riverside Cardiology, I take that role very seriously, and that's why I'm very excited to be starting the Women's Heart Center. Thank you so much for your continued support of Riverside and Riverside Cardiology. In particular, we have been able to acquire scales for our patients all the way up to the newest and greatest technology. And all of those are incredibly important to providing state-of-the-art care to our patients right here.
We represent a very, very comprehensive team that really appreciate the support of our community, the foundation in particular. Without it, we really are not as successful successful. But this is actually where the action happens. So when you come in with your heart attack or stroke, we'll be ready, and we appreciate your support.